All right, so the talk today we're talking about, yes, okay, thank you, about gaining bladder control with physiotherapy. So our overview tonight is to talk about lower urinary tract symptoms called LUTS, pelvic floor muscles, trying to find them, what happens with prostate cancer and incontinence, looking at physiotherapy treatment, how can this help you, and as well as bladder control. So, you know, there are a lot of comedians and cartoonists actually that use incontinence as a source of humor, but for people that actually have incontinence, it's not really a laughing matter for them. And so to have accidents and embarrassing situations is not what anyone would like. To be stuck wearing pads all the times also, not very nice. And I think as we age, there's always this fear that our incontinence will get worse, and what will we do about it? So we're going to talk about getting rid of pads, and so that physiotherapy, offers hope and offers solutions for men having problems with incontinence. Obviously, we see women as well, but pelvic floor physios, but tonight is really looking at men. And I think that having incontinence, it can be very isolating. People are scared, they lose their confidence, they become reclusive and reluctant to go out and join in social events. So we're trying to help people improve their quality of life. So what could be some of the causes, not all the causes, but some of the causes is obviously the aging process. One of them that I haven't put in is actually some disease processes, like if you get Parkinson's disease, for example, dementia, that's all going to affect incontinence. But also some men suffer from a benign prostate enlargement, or BPE, or another term that's commonly used is benign prostatic hyperplasia, where you get an enlarged prostate, so the individual prostate cells actually enlarge and the overall size of the prostate enlarges. And this is part of growing old that this happens. And this can affect men's incontinence. And of course, when you've got an enlarged prostate, this can lead to bladder outlet obstruction, or BOO. Yeah. Yeah. And these symptoms are not necessarily associated with prostate cancer, because the cancer cells actually grow in the mid part of the prostate to the outer areas of the prostate and don't always affect continence and cause symptoms. It's quite a silent disease. So with men as well, if they undergo prostate surgery or they have a TURP, so this is for the benign condition, the enlarged prostate, they will have a TURP, which stands for transurethral resection of the prostate. So they go in or a green light laser, and they clear out some of that middle area where the urethra is and widen it so that men can urinate properly. Also, radical prostatectomy, of course, for prostate cancer can affect incontinence, as well as men having brachytherapy and radiation as well. So what are these symptoms of LUTS? Well, they're characterized by the frequency of going. So most people drinking an average amount of fluid should maybe be going 4 to 6 times a day if you're my age, but as you age, you might go a few more times. It might be up to 6 to 8 times, once or twice at night. That's considered normal. But these are people that are going 10, 12 times during the day with lots of small volumes. Obviously, for some people, there's a real urgency to go. Sometimes that's associated with incontinence. Waking up many times at night, that's nocturia. So they're up 3 or 4 times a night. Hesitancy, so difficulty actually starting your flow, that could be a symptom. Or intermittent stream, the flow stops and starts, not just a nice steady stream. There might be some terminal dribble, which means that it's difficult to end off. It just keeps on dribbling, dribbling, dribbling. There might be an after dribble or a post-void dribble that happens with men, in that they do finish, but then in, pulling their pants up, shorts up, trousers up, there's another little extra dribble afterwards that happens. And obviously different types of urinary incontinence. So, the bladder dysfunction that happens, we can divide it into two areas. So there is one that's called overactive bladder, or OAB. A lot of women also get OAB. And this is a storage symptom. So these are people that are going to get urgency, frequency, waking up many times a night, and it might be associated with urge incontinence that's leaking on the way to the toilet. But on the other hand, there can be the bladder outlet, the BOO, which is the obstruction, and this leads to voiding symptoms of hesitancy, weak stream straining and dribbling, but it also can lead to the feelings of overactivity and not emptying properly. And it's quite common, a lot of younger men, look at that, they're in the blue here. Those are the 45s to 49, will have some not incontinent, but symptoms of lower urinary tract symptoms. Obviously, as we age, we can see that this does increase. But surprisingly, on this is how many younger men also have symptoms of lower urinary tract problems. So the prevalence in Australia, well, us poor women, 1 in 3 of us, especially if you've had a vaginal delivery, will have some form of incontinence during your life. And men, it's going to be 1 in 10. It's obviously more common, as we saw in the previous slide, in men as they age and over 75. And of those, up to 40% of this age group, of the over 75s, will be affected. And so while incontinence increases and gets worse with age, I think the message, it should be my take-home message really, is that it can be successfully treated and managed at any age. So there we go. I couldn't find one with a man, but I'm sure a lot of you will have a bit of a laugh. So this is the sign of actually what's called stress incontinence. So stress incontinence, I know it's a strange name for incontinence. It doesn't mean that you're stressed. It means that when there's pressure down on the bladder with movement, a cough or a sneeze, a bending, lifting, getting out of a chair, that you actually leak a little bit of urine. It's not dependent on how full your bladder is. It can happen even if you've just gone to empty your bladder recently. You can have some stress incontinence. Another symptom can be the real urge to get to the toilet. Will I make it? Won't I make it? Oh my God, where is the toilet? Okay. And of course, well, while you're panicking and running to get in there, will you make it in time? And is there some urge incontinence, some leaking actually getting to the toilet? And I think the Continence Foundation actually put out a book, I'm sure they still have it, about where all the toilets are in Sydney. So, it can be very daunting if you have urgency and that's your issue. It can be very daunting if you're going to a new place because your immediate issue is, well, what do I do about the toilet and where is it? And so, a lot of people rule their life about, well, where is the toilet? Okay, so what does physiotherapy offer? Why am I here? Well, we offer the conservative management for incontinence. People coming to me, we do a detailed assessment. There are a number of treatment modalities that we use. We offer education, advice, and of course, ongoing support. So let's find these pelvic floor muscles in men. A little bit different in women, but let's try and find them. So here we go, your anatomy lesson. We have the urethra, It goes up through the prostate. That's why when you have that benign condition and an enlarged prostate, there can be a problem with flow. That's the bladder over here. At the back, we have the bowel coming down. This part in the front is your pubic bone, part of your pelvis, and at the back of you we have the sacrum coming down to our little coccyx and tailbone. And the pelvic floor muscles are actually sitting right down underneath you. So anyone ridden a bicycle? Or maybe not recently. Yeah. But that area that you sit on the saddle is your pelvic floor. So that whole area underneath you is filled up with a group of muscles we call the pelvic floor. Also very importantly is this little muscle called transverse abdominis. This is a muscle that comes from your back, wraps around and comes right into the top of the pubic bone. And it's a stabilizer for your back and it works with your pelvic floor muscles. It's the only muscle that should work when you're doing a pelvic floor contraction. And it shouldn't be the upper tummy muscles. So, you know, people often talk about the core muscles, get very confused because they think the core is their tummy muscles. But it's only these really deep lower abdominal muscle is the part of the core muscle, not all your abdominals. And if you start using all the abdominals when you do a pelvic floor contraction, you might cause leakage or have more problems. So we really have to identify using the right muscles. Okay, so what does the pelvic floor actually do? Well, it is there to help maintain continence of both bladder and bowel. It comes on in response to increase in abdominal pressure. If we cough or we sneeze, our pelvic floor should come up in response to that. It's going to support all the pelvic organs, and it's very important for sexual function as well. And it relaxes when we need to empty bladder or our bowels. So let's have a little look at the bladder. So the bladder is just like a balloon. When it's empty, it's small, and as it fills in urine, which it gets from the kidneys, and they come down through the ureters from your kidneys, it starts filling up and it starts expanding. And your bladder is actually just a vessel for storage. That's its main purpose. And when it's full enough, it's going to give you a signal. It gives you one actually when it's filling. That's your initial feeling of need to go. It's not a very strong urge for a lot of people. But then it's going to fill a bit more and it's going to say, we better start looking for a toilet. And then it's going to get a bit stronger and it says, we better find one soon. Because if we don't, we're in trouble. So we also have this area in the bladder called the trigone area. And so these ureters actually come into the top of the bladder at that area. But right down here is the bladder neck. And we have a really sensitive area over here. So you do have an internal bladder neck sphincter that helps to keep you dry. And in men, it's really important. It prevents seminal fluid going back into the bladder during ejaculation. But also, when you relax your pelvic floor muscles sitting down here, some urine will hit this area. It's like a little spot, a wee spot. And your bladder then gets a reflex action and it contracts down, so that you will then urinate. And when you've stopped urine past this area, it actually switches it off and it kind of tells the bladder to quieten down, settle down, we're finished, and you stop urinating. So we have sphincters. It's a funny name, isn't it? But sphincters actually like a valve. And you have these sphincters in male and female that are keeping us dry. So in the female, you can see that we've got this very short urethra. And so we have to rely on our pelvic floor muscles a lot more than men to keep us dry. But for the man, he's got this prostate and he's got a very long urethra. And so while he has pelvic floor muscles, and a lot of men tell me they never even knew they had pelvic floor muscles, but you actually do. But this is a mechanism that's also keeping you dry until there's an issue. And until when we have prostate surgery and we remove the prostate, and maybe same time it can happen with men with having a TURP operation for an enlarged prostate, there's some damage or trauma to the sphincters, well then, you know, you're going to land up with a sphincter that's not working 100%. It's a bit like a leaky tap, you know, where the washer doesn't work properly. And you need to come in with your pelvic floor muscles and add more closing force to help that sphincter to keep dry. And I think a lot of the issue is that a lot of men don't even know where their pelvic floor is, not like women, you know, we have to know about ours with childbirth and things like that. But also these muscles that now have to work for you, they can lack endurance and, you know, get tired very easily. And so some men find that they just might be standing end of the day and they just go, oh, I had a little leak. I didn't even know. Didn't feel like going, wasn't doing anything, but I just lost a little bit. And it could be because there's, you know, some fatigue happening in the pelvic floor muscles. All right, so let's look a little bit more closely at the sphincter because it is quite interesting, and they only knew about it more recently with MRI scans. They used to think it wrapped around the urethra, but it actually doesn't. It's very clever. So in a man, we have the prostate, and sitting underneath in the front, so if this is the urethra, and this is the front of you, in the front, you have the sphincter, and it comes around, and it actually is like a horseshoe shape, so it doesn't go right the way around, okay? But very interestingly enough, coming in to the back of that are our pelvic floor muscles. So we can then get the sphincter and we can get the pelvic floor muscles, and we pull on them, we get them together, and they can kink the urethra and help give us control. So our pelvic floor is made up of, you don't have to remember the names. It's not going to be a test afterwards. But what we do have is we have superficial pelvic floor muscles, and this is the anus over here. They're the testicles. Someone's lying with their legs spread open. But these are the superficial pelvic floor muscles coming around the anus just over there. But then we have this very deep pelvic floor layer as well, and we're going to talk more about those. So this is the deep pelvic floor muscle layer that comes around the anus. This is the bowel coming down there. So we have superficial and deep muscles. So before we talk about the specifics of actually doing exercises, there, you know, the surgery does affect different parts of the man's anatomy when he has it. So when they do the surgery, they're going to cut below the prostate there and right at this bladder neck, and they're going to take that out and they're going to join this area of the urethra back to this bladder neck. So of course, that bladder neck with that sphincter, you know, most times it's going to get damaged. It's not the only one for incontinence, but it is one of them, and that does get damaged. But that'll get damaged in men that are having the TURP procedure and green light procedure as well for an enlarged prostate. Okay, so a lot of men will have nerve-sparing operations, and these nerves are not the nerves that really affect the bladder or the pelvic floor. These nerves are for erectile function, and you can see, look at them, what the surgeon has to cope with when they do nerve-sparing operation. You know, it's amazing to me that they can even dissect these nerves and spare them. But of course, you can imagine the trauma to the nerves, and this is why a lot of men might have an issue with erectile function after the surgery, and it can take a while for erectile function to return. Okay, this is the one that no one, you know, the surgeons don't always talk about, but when they do this operation, we can get shortening of the urethra. And I think as well, like if men don't get length, we'll talk about it as well, but if you don't get any length to the penis post-surgery, then the penis, which has got erectile tissue in it, is going to contract, and the penis is going to shorten as well over time. And a lot of men have a problem because it really shortens right back, so it's almost flat with the abdomen, so standing and urinating is really difficult. because it's just going to go straight instead of down, and that's a real issue for a lot of men. And of course, well, you know, the surgery can affect the external urethral sphincter, which is the one that's down here and very important for continence. And I think that the surgeons have got a lot better in their techniques than when they did the surgery, you know, many years ago when I first started. They're a lot more drier men with it because they're identifying the sphincter and really trying to preserve it. But even so, post-operatively, men will still leak because there's been trauma in this area and there's been trauma to the sphincter, and it takes a while perhaps for that sphincter to improve and, you know, help with incontinence. And as well, I think there's a big issue with radiation therapy, whether you have radiation and brachytherapy just instead of a radical prostatectomy, or whether you're having it post-surgery for different reasons if they're not sure whether they've got all the cancer, your PSAs are rising, can be damage to all the areas, organs in and around the area. And I think pelvic floor muscles is also very important with radiation. Although I don't often see men that go for radiation, the doctors don't often send them for physio because initially they'll say there's no issue. But I think it is important, and I think it will come out in the future how important it is to keep those muscles strong with radiation. So let's look once again at finding these pelvic floor muscles and how do we do a pelvic floor contraction. So we're all going to try it. Let me take my trusted chair. And so you're all going to sit up and you're all going to wake up, because I might have been a bit boring, but now's the time to wake up. And you're all going to sit up really tall on the front of the chair. So you're going to slide your bottoms to the front of the chair and you're going to sit up really tall, because posture is very important when we do a pelvic floor contraction. And I want you to feel certain areas. So firstly, what I want you to do is I want you to pull up, like as if you had wind or diarrhea. So really feel the deep pelvic floor muscles. These are the ones that are going to lift the anus towards your head. Okay? So you're going to feel that you can pull up as if you were stopping a wind or diarrhea. Okay? Those are the deep ones. But those aren't the ones that are so important for your pelvic floor. So when we pull up, you should feel the lift of the anus. And this is very important for bowel control, okay, which we also need as we age. But because we're talking more about urinary control, I want you to take your focus more towards the front of you, okay? So more towards those more superficial muscles that had all fancy names that I showed you before. So that when you pull up your pelvic floor, I want it more to be in the front. So I don't want your focus on the anus. I don't want that to be the loudest feeling that you get. I want it to be more in the front. So that if you pull up these anterior muscles, it's kind of feeling like you were going to very cold water. And so the scrotum and the testicles lift up, and you feel the retraction of the penis, okay? So that is the one I want you to focus on. Not for women. So us women are a bit different. We actually, when we do it, we work for continence, we've got to feel much more the deep pelvic floor muscles, and we've got to feel this real lift of the anus. That's the one I want you ladies to focus on. For men, they've got to bring it more forward, and they've got to focus on more the other bits and pieces that we don't have. Okay. And that's more for men. That's for urinary control. Okay. So one of the newer kind of slogans is to try and lift your nuts to your guts. Okay? Nuts to guts, fellas. All right? And that's for urinary control. All right? Yeah. Yeah, it's perfect. So, you know, men are are quite lucky because, as I say, they can get movement of their bits and pieces, and they can use a mirror and they can put their hand in, they can actually feel what's happening, and it's very good for you to do your own self-examination and see if you get it. I've got a nice new little machine called a real-time ultrasound machine, and so some of you men before used to come and I'd have a little look, but now I can just do it under your underpants with my little real-time ultrasound, so it's less embarrassing, and we can actually see the movement of these more anterior muscles. We can see them kind of glide together and lift together, and we try and look at the deep pelvic floor muscles and say we don't want that too strong, because some men come in and they've got this big lift of the deep pelvic floor muscles, and that's not helpful. We want more of these anterior muscles doing. So we have to calm that one down and try and find more of the front working, okay? But sure, mirrors are perfect. I always say stand in front of a mirror and try and do it. So very important that you find the right muscles working. And so you should be aware of just the very deep lower abdominal muscles when you do that. It's got nothing to do with the upper abdominal muscles. It's not this whole evo of your chest to try and lift your pelvic floor. That's not it. Okay, you have to be able to breathe and talk when you're pulling up your pelvic floor muscles. Yes, okay. And obviously exercises can be done in sitting, in standing, and in lying. So before surgery, well, I really like to see people before the surgery. It's not always possible, but if they can, because if you haven't had surgery, your pelvic floor is working for you properly, and it's a good idea to find it without having any pain and working out where it all is and how to do it. And then if we've got time, well, then we might be able to improve the strength and the endurance of the muscle contraction. And men that have been seen before surgery, I think, do a lot better post-operatively. And then we need to learn, well, how can we do, well, a lot of times you'll read on the internet books about the neck. So it's actually being able to pull up your pelvic floor with coughing, with sneezing, with bending, with getting out of a chair, with any types of activity, gardening, playing bowls, anything that you're doing. It's like, where's my pelvic floor? And I've got to be able to use it. And it helps as well if I strengthen my lower abdominal muscles, strengthen my legs, so I can hold my pelvic floor, but I'm not struggling to get out of the chair because my quads are so weak. You know, because if I'm really going to effort to get out of a chair and struggle to get out of a chair, well, I might be pushing down through the abdomen and causing a leak, you know. So we need to find those muscles as well. And of course, your pelvic floor works best with good posture. If I'm slouching, all of you sitting slouching, try and pull up your pelvic floor, and you might go, it's not as easy as when I was sitting up tall, or if I stand up tall to do it. Post-operatively, well, as soon as you've had the surgery, obviously, we want no pelvic floor exercises when you have a catheter in. So when you wake up after the surgery, you will have a catheter in place. So no pelvic floor exercises until the catheter's been taken out. And once it has been taken out, we start with some pelvic floor work. We start slowly. So you've just had surgery. We don't want to go too hard, too fast, too strong, because sometimes you can cause leaking because you're overdoing it. And these muscles, you know, just can't cope. And I've had a lot of men actually quite recently, they're just overdoing it. It's like, you know, I go, give it a break. You're trying to run a marathon. You've just had surgery. You're trying to do 42 Ks, and you've only really trained for half a kilometer. You know, you're just expecting too much of your body. And, you know, a lot of them will find if they just have a quiet day and just relax and don't do anything, then continence actually improves. So we need to find that balance. And also, if you go too strong, too hard, you've had surgery, we don't want to cause more pain. So we make sure that sitting on a hard chair might not be comfortable. So why don't you do it when you've finished on the toilet, sitting on the toilet when there's no pressure might be comfortable, or lie down and do them. So we have to look at all those things in the immediate post-operative part, and then our rehabilitation will be, well, fine, now we're getting better, let's intensify our exercise program. And also, I think that's very important, is to look at the quality of your contraction rather than the quantity. And you know, some people come and I say to them, you know, you'll see my prescription, but you're going to exercise 3 times a day. And what do most men think? What does Taryn know? 3 times a day? What's the harm in doing 33 times a day? That must be better for me. You know? But all they do is cause fatigue of the muscles, and then they have more problems. Okay, so, you know, it's rather important to just do better quality exercises than fortunes of them. Oh, excuse the spelling, American spelling mistake, Vigili. Okay, but I have a look at the exercise program and target to whatever your personal needs might be, getting you to use them with all activities. And we also do some bladder training, because quite often men, before they go in to have the surgery, do not have fabulous bladder capacities. They might have that lower urinary tract symptoms of going frequently and all that type of thing, waking often at night. And this is also a symptom of post-surgery. So we need to get that back. We need to get a good functional bladder capacity and do some bladder retraining. And your program might last for a few weeks, might last for 6 months or till you're continent. It really depends. I have some men that come in that are perfectly dry. I've seen them before. They know what they're doing. The surgeon's done a great job. The surgery's been uncomplicated. And, you know, I might see them once and that's it. They're on their merry way. So, let's talk about doing some exercise. Of course, you don't need to put the barbell there. But honestly, the research has shown that if you're doing your exercises 3 times a day, and we do 8 to 12 contractions where we hold each one for 10 seconds and have a rest of about 5 to 10 seconds in between, and we can do them in lying and sitting and standing. And we also do 8 to 12 of fast contractions. We have different muscle fibers that make up our pelvic floor muscles. And we have slow twitch muscle fibers. These are our endurance muscle fibers. And we have our fast twitch muscle fibers. And these come on when we move quickly, when we cough, when we sneeze. We need to have them coming in quickly. Otherwise, you might have some stress incontinence because it just misses the whole event. You know, it comes in after you've leaked. Okay. Let's have a little look at some good bladder habits. So this is what we should be doing. You know, a lot of people, when they have urinary incontinence, the first thing they do is they stop drinking because they think if I don't drink, well, I won't leak. Yeah. But that's not helpful because our bowels and everything else needs the fluid. So we should be drinking 1.25 to 2 liters a day unless your doctor has cut that down for certain reasons. Obviously, caffeine, well, there you go. That's a thing that can affect your bladder for some people. Some people know they they can cope with their caffeine. Other people, they can even have just 1 cup and it can affect them all day. So it really does depend. And green tea has caffeine in it as well. Okay, yeah. Alcohol, there's an interesting one, okay. Well, alcohol is a diuretic. I mean, caffeine is also diuretic and it's a stimulant. It can make you urgent to go to the toilet. But alcohol is a muscle relaxant, but also a diuretic. You know how you feel? You feel all, yeah. But for someone who has just had a radical prostatectomy, if you're going to drink a lot at night when you're tired, and you're fatigued, and you add alcohol to the equation, what do you think is going to happen? Good or bad result? Bad, exactly. It's not like you can never have, but you have to kind of watch that, you know, because some men can be quite affected by that. And when we've built up your endurance and things like that, yeah, then you can. And it's not like you have to be a teetotaler. You can have, but just be moderate in how much you're having. And I think like sometimes people, you know, they go to maybe a function and then they're standing around and that's tiring, and then they're drinking and then they go, oh my God, I'm wet. So, you know, you've got to understand the effects of alcohol if you're going out. Avoid going just in case. Well, you know, research has shown that all of us will have a, you know, an occasional just in case void. You know, I'm going to a movie, well, haven't been for an hour. I don't necessarily need to go, but I know the movie's a 3-hour movie. I'm going to go before, you know, but it's, when I'm talking about just in case, this is someone who's going frequently, you know, oh, I better go now before I leave house, and I better go as soon as I get to the shops, and I better go while I'm at the shops, and I better go before I come home. And, you know, their life is determined by better goes, just in cases. And then we need to make sure that we empty properly without straining, very importantly. And we need to empty our bladder completely, just going back to this term, because we can get urinary tract infections if we're not emptying the bladder properly. And also for some people who are waking up often at night, you know, maybe it's worthwhile drinking more in the morning, less in the late afternoon, it's evening. We still have to be drinking the right amount of fluid in the day, but we can certainly look at the timing of that and maybe stop drinking 2 hours before going to bed. So, you know, we can do something about that urgency and that urge, you know, learning a few urge control techniques. And one of the main ones is if you pull up your pelvic floor, this is men and women, guess what it does to your bladder? It tells it to keep quiet, you know. So that's one of them. I'll tell you another one in a moment. So when we do bladder retraining, we need to get to a normal functional bladder capacity, that you're not running all the time, you're not waking so many times at night, and that you can, on a minimum of what we were drinking before, you can last, you know, 3 hours. So deferring 3 hours. Sometimes with people, I do what are called bladder drill programs. Strange name, sounds like I'm drilling to your bladder, but I'm not really. They just exercises, making you go a bit more frequently and then slowly increasing your hold time and building up that capacity of the bladder. We need to make sure that we're drinking enough, because if you're not drinking actually and your urine is getting very concentrated, that can also irritate your bladder. So I say to people, you know, you've got to look at your urine. If I'm drinking a lot, your kidneys, you know, if they're working well, they do a good, they're really good at you know, they're really good at retaining the fluid if you're getting dehydrated. And you might notice that, because if you go, you got like quite darkish color yellow urine, where if you're very well hydrated, you know, you go with like very clear urine. So you can often tell if you need to be drinking a bit more about what color your urine is, unless you're taking vitamin B, that's going to make, in your multivitamins, that's going to make it fluorescent yellow. Okay, and so when we're doing retraining, we might look at your bladder, at your caffeine, and also using urge control techniques. You know what another one is? So apart from pulling up your pelvic floor and crossing your legs, is actually to curl your toes. So have a go at that. Really scrunch your toes. If I had sandals on, I'd show you them, but I don't feel like taking off my boots. But really scrunch your toes. And then when we scrunch our toes, it actually works on a nerve at a spinal level that kind of quietens the bladder down, and it does work. So you know how you might see little kids and they kind of hold themselves and they're dancing up on their toes? We kind of lose that, but, you know, I don't expect you to look like that. But, you know, we could stand and get our legs a bit and pull up our pelvic floor and scrunch our toes. You know, and then I think there's also, this is as we age. I mean, sometimes people have a problem with getting to the toilet because you know, their hips and knees and their back sore, and instead of being able to get there quickly, you know, they can't get there as quick as they used to get there. And I think, you know, sometimes with very elderly people, you have to kind of take that into account. So, there we go. Should be Taryn. Okay, so some men do suffer from this post-micturition dribble. It's not always associated with prostate cancer or any problem like that. But pelvic floor muscles have been shown to be very effective. So when you're finished urinating, if you really pull up your pelvic floor muscles a few times, you might be able to get rid of those few extra drops before they cause a problem. And also you can, which I'll show you on the next slide, is do what's called milking the urethra. So what happens is that you get this little pool of urine sitting underneath you. And so when you kind of walk away, that kind of dribbles out. And so firstly, if we pull our pelvic floor up, that's like taking a hose that's got a little kink in it and pulling it straight. And so it's the only time when you do a pelvic floor contraction that some urine is allowed to come out. Other times there's not allowed to be any urine coming out when you do a pelvic floor contraction. But you can get in behind the scrotum with your thumb and push up. So you're pushing on this area here and push it forward. That's called milking the urethra. So it's quite an easy technique to learn to do. But actually it has been shown that just really doing a good pelvic floor contraction kind of works just as well. Okay, so last but not least is to talk a little bit about vacuum pumps. Because remember I said about the shortening of the penis. Well, for erectile function, yes, you know, you need the lengthening of the penis. And sometimes doctors will put you on medication as well. But the thought is that you actually need to do this because it helps lengthen the penis. It helps that erectile tissue lengthen and stay long, and so that the whole penis doesn't shrink over time. So it's something that you can find out post-surgery when you should start from your doctor. Some men just do it in the shower, 5 minutes, 5 to 15 minutes. Doesn't always have to be associated with sexual function, but just getting that lengthening of the penis, and do it, you know, probably 5 to 7 times a week to help with that. So we need to keep fit. That helps. We need to keep active. That helps too. Keeps us nice and strong. So get out there. Just because you're leaking, it's no good giving up your walking and things that you like to do. You hopefully can get better, but with the continence. You might want to take up a new sport, although I don't know, those look a little bit drastic, don't they? But it could be something like Tai Chi. It could be some gentle seniors exercise groups. There's lots around. There could be playing bowls, things like that. Get out and do things. So take-home message, help is available. Continence is achievable in most cases, but if not, there are other things that surgeons can offer you. Thank you, and thank you to Dr. Pauline Chiarelli for the use of her wonderful anatomy slides.
I'm sure we have many questions that we would like to ask Taryn. Who would be first?
Is it working?
It is.
In the bladder training area,
Yes.
I think when you and I talked some 4 years ago, we focused mostly on volume.
Yes.
Not going to the bathroom until you had a certain amount of volume to
Yes.
void.
Yes.
I've recently been hearing that another important consideration, or maybe a consideration replacing the volume, is the length of time between voidings. Would you comment
Well,
on that?
they kind of go hand in hand, because if you have a nice bladder capacity, you're going to get 3 hours or so before needing to go. But it does depend on how much you're drinking. So sometimes if you're under drinking and you're dehydrated, wow, it can look like I can go 5 or 6 hours, but when I go, I've only got a small volume. So you have to be drinking enough to get a good volume. It does, you know, it's time, and it's also how much capacity is in, because sometimes, you know, they don't always work out together. Sometimes someone can be drinking a fortune. I have a lot of young girls, you know, this is like the new thing. They just walk around with their water bottles all the time, and they just drink and drink, and when they add it up, it's something like 4 or 5 liters. Well, they're not even going to get an hour, and they've got a normal bladder capacity. Okay, so we have to look at both. We look at the time and how frequently you go to the toilet on the charts, what is the interval, and then we look at your volume as well. Yeah, we need both. Thank you.
Is the pelvic floor exercise you're talking about, is that for life?
Well, why not? I think, you know, once your pelvic floor has built up, if it's very, very strong, then it's easier just to maintain it. Okay, but same as you do general exercise for the rest of your body, why not your pelvic floor? You know, you're going to strengthen your quads so you can stand up out of a chair, because as you age, if you haven't got the strength in your hamstrings and your quads, you're going to struggle to get off that couch. So, and I think men that have had pelvic surgery, and for whether it's the benign condition or, you know, even if it's radiation or even if it's for radical prostatectomy, they've had some incidents there. And so I think, you know, as you age, you probably got more risk factors of getting incontinence as you get older. So I think it's very important that you keep these muscles strong, more important maybe than someone who hasn't gone through anything, you know. And the exercise prescription that I gave, that's a lot for building up your muscles. All right. Once they're very strong and you have no issues, well, then like it's a maintenance dose, you know, once a day. Some people say, well, I'll do it 3 times a week when I go to the gym, you know. And then I think also it keeps it strong by having good posture. If we have good posture, your pelvic floor muscles are on a bit. If you've got poor posture, they're off. And it's not like they can never be off, but with good posture, we have a good resting tone of our pelvic floor. But then if we're using them every time you're bending and every time you're getting dressed and every time you're lifting and in the garden, that's also going to help keep them strong. That's why activity is important. If you're just going to stop doing everything and just sitting in a chair all day, you'll get weak. And you'll end up with worse symptoms than if you keep active.